Welcome back to Zen Talks, where we talk about Zoho Creator. And today's topic is something really interesting and honestly very impactful. We are talking about the medical industry. Hospital, clinics, home health care providers, they all run on processes. And when those processes aren't structured properly, it doesn't just slow down work, it affects patient experience. So today we are exploring how can Zoho Creator actually help in the medical industry. And joining me as always, Dash.
It's me. Hi.
And joining me today is our in-house Zoho Creator expert, Mr. Alan.
Hello,
Welcome
everyone.
back.
Hi, Namrata. Thanks for having me. And this is a topic that I'm really interested to talk about because the medical industry is one of the best examples where structured systems make a real difference in their management.
Let's start simple.
Okay.
Why is the medical industry such a strong fit for something like Zoho Creator?
Okay, so let's start here. So because healthcare institutions run on extreme coordination, it's essential for their working, and because doctors, nurses, lab technicians, let's just say front desk staff, reception, billing teams, pharmacy, all of them depend on timely information. They need it as soon as possible, as efficient as possible, right? And most mid-sized clinics and hospitals still manage most of these internal workflows manually through Excel sheets. It could be paper forms. Paper forms are used a lot, WhatsApp communication, etc. And this causes a lot of confusion, right? Because we personally have seen hospitals, take up, all these information. Doctors give out information manually. We have to take it up to another department. They have to give their approval. Then you take it to the pharmacy, get the medicine, get appointment, get admission for any tests. So it is extremely manual. They make you run from one department to the other, one location to the other. It reduces efficiency so much, and it could really save someone's life if it's done more quickly. I'm not necessarily life, obviously emergency situations are taken with more care, but it can save a lot of time.
So what you're saying is that you have to replace hospital system, right?
Not replace exactly. So Zoho Creator is not meant to replace core medical record systems. It's meant to fill the operational gaps that exist within the system. Like how I just mentioned, there is a lot of, from here go there, you have to go to the inpatient department, then meet the doctor, then make an appointment with the receptionist to meet the doctor. Then after meeting the doctor, you have to go to another person. So it causes a lot of lag. This can reduce that.
Yes, I completely agree on that. Let's break this down, shall we?
Yeah.
Suppose we are a mid-sized clinic.
Okay.
What's the first thing Zoho Creator can do to help hospital and medical institutions?
So, okay, fine. Hands down, the most important thing it can help with is patient intake. So, patient intake relies on so many things. When a patient comes to a hospital, they have to fill out their form. What is their, grievances? What is their disease, etc. And once that form goes into, it gets taken out in their system. This is fed. If there is a system at all, it goes to the doctors, the relevant department. So let's just say someone suffering from varicose vein, for example, it goes to the neurology department. Or the respective department. I assume it's neurology department, and the record reflects there. But then again, you still have to, they give you a paper. Then you have to take that paper, go to that reception, then make an appointment with the doctor. So patient intake itself takes a long time, right? So instead of paper forms, patients can pre-fill digital forms. We fill digital forms on a daily basis, and these things are not now readily implemented in hospital systems. Also, there is something called patient ID. So each patient has their own ID card. So in most hospitals, they actually give an ID card with a QR code, barcode, which can be scanned. So most medicines are given in the card. You don't have bills anymore. So that can also be automated. So there's one more thing that is very important is assigning department based on symptoms, right? So automating that can reduce a lot of confusion between departments and the queue management. Like there'll be a lot of patients waiting in queue to meet doctors, and most of the time when reception calls out these patients, they might not understand, they have the token system and all. This also can be automated, which, like, imagine the workload reduction for front desk staff. It will reduce drastically.
As even my mom works in a medical industry, I can see that they take 2 hours of time to fill their forms, to sit and fill their forms other than the operational things. So I think this might even help them, which is even having a small town people. So according to you, the management will benefit a lot.
Yes, absolutely. So they can see, how many number of patients came in that day, how many are waiting, what is the waiting time for each patient, how the, patient load is managed by different departments. So this provides a lot of clarity to the hospital management. So continuing, another big one is follow-ups. So many clinics rely on staff to manually remind patients when is their next checkup. So let's just say, if the doctor intends you for an X-ray, and your appointment is on, let's just say, next Monday, each of then you will be redirected to the radiology department. Someone from the radiology department has to contact you to tell that your appointment is on this day. This again is manual work that can be automated, and you can save a lot of time. So Zoho Creator in this situation can, trigger these follow-up reminders. It can track missed appointments. It can alert the staff for high priority patients, right? So there is, no dependency on these manual processes.
Actually, this is interesting because I have seen a lot of hospitals struggle with things like, this was this one time where it took forever for me to collect a blood test report, which shouldn't really take that long.
Yeah, so see, lab management is huge for hospitals. Think of this. Almost all patients coming in on a daily basis or getting admitted on a daily basis require some form of testing. So there is a heavy influx of test requests as it is, results and reports coming in on a daily basis, right? It is a heavy workload as it is. Now it's a breeding ground for confusion with, a lab management feature custom made in Zoho Creator for your own hospital. It can change the game completely. So let's just say, it can, your samples can be logged at collection, as barcodes can be assigned to each samples. It can be tracked through each stages of testing, and these status will be visible to the front desk. So whenever a patient comes and asks, okay, what is the status of my thing, it will be readily accessible for them. And so there's more, right? Like hospitals also have, other non-medical things like, purchase approvals, equipment maintenance requests, vendor management, shift changing.
Internal.
Yeah, so all of this can be, simplified by integrating these features in your hospital management app in Zoho Creator.
Okay, for the better understanding for our audience, can you explain this further with an example maybe?
Yeah, sure, I love to. So let's take a real life scenario.
Okay.
We built something like this for a diagnostic center with 3 branches in total.
Okay.
So the problem they were facing were mainly their reports were getting delayed, which is very frustrating. Which is a very frustrating experience for patients, right? And their sample tracking system was a mess, which led to a lot of confusion. And they also had no visibility across their other 2 branches. And they were ordering their stock manually, and their patient follow-ups were extremely inconsistent, which caused a lot of problems for them and the patients, because patients kept missing their appointments and were later, frustrated with these delays. So what we essentially implemented in their management app to tackle these situations were a few things. So if anyone interested, if anyone in the audience resonate with these problems, you might want to pay attention. So what we did was, centralizing their sample tracking system. This was huge for them. We also automated their report status dashboard. We gave them branch level access controls. and inventory tracking for lab consumables. This was also a huge thing. And on top of that, automated patient follow-up reminders. Again, it helped the diagnostic center a lot, keeping track of the patients.
Okay.
So what the result was, so doing this simple automation, this simple setup, gave a 30 to 40% faster internal coordination, which is huge, because
great.
coordination is the core part of hospital management, and it reduced phone calls for report status. If nobody is calling you every day asking what is the status, and stock management was easier. And the audit trails were much more clearer, and this didn't replace their medical system, right? It was complementary. It supported them. It made it better.
That's pretty efficient, like especially the cross branch visibility, right?
Exactly. So another interesting sector is home healthcare. You know how nurses are sent to some critical patients or elderly patients home to take care of them, and again at the end of the day they give a manual written report and they submit it, right? So this also can be automated. It can work much more seamlessly. How the nurses can update their visit logs, they can capture the patient's vitals, they upload the reports, and do the billing all through a mobile app. Yeah, exactly. So you see how it reduces a lot of paper trail and makes it much more efficient and accessible almost immediately.
And even NGOs, right?
Of course. So for medical NGOs, tracking patient sponsorships becomes way more easier. They can manage donor linked treatments.
Okay.
They can monitor medicine distribution. They can generate compliance reports. So we actually built an app for NGOs. It's called Zendonor. Yes, I'm pretty sure everyone knows.
Yeah.
So Zendonor does this exactly. They track donors. They manage donors. They keep track of everything, campaigns, everything. Right. So it does exactly what I'm just talking about.
For
Here
NGOs.
In this example, it is for medical NGOs, but Zendonor does it for NGOs in general.
For donor management, basically. Yes. We have talked about exception before. In healthcare, they must be frequent, right?
Almost all the time, right? So emergency cases, VIP patients, critical lab results. So these are very crucial elements for hospital management. And here, Zoho Creator can flag these urgent cases immediately, and they can escalate it to senior staff. Excuse me. They can notify multiple departments if necessary and override standard flows safely. That's crucial for healthcare because these require a timely, efficient, management. They need to be taken care of immediately and without flaw.
Like, what about compliance? Like, that's a huge in medical, right?
So, absolutely. I can help you with that. So, Creator can help you or help the hospital in, auditing logs, access controls, get the approvals time-stamped, custom reporting.
Custom reporting, yes.
Yeah, so management gets these insights without, manual reporting. It makes everything so much more easier.
What's the biggest war moment according to you?
So I think, when hospital administration realize that they don't need to replace everything, right? So that's a huge, moment of clarity for them because they usually they're scared that they might have to replace their existing system altogether, which is not true. They can digitalize gradually. They don't necessarily have to. So according to your priorities, whichever areas you are facing a problem in, you can gradually automate that first, digitize that first, and you can slowly work around it. And they can customize these workflows exactly to their SOP. And that's when it clicks for them. And when they see how it works like a well-oiled machine, they actually appreciate it more.
So no more confusion and lost reports, right?
Exactly. So there's a lot fewer people in the office chasing around each other, chasing around paper. Like the staff has time to do what actually, what's actually worth it.
I'm gonna definitely send this link to my mom to watch it because she needs it the most, I believe. So it sounds more like a healthcare reform, right?
More like a operational reform, I can say. So when they say, we are growing, but struggling internally, or there are too many manual setups or too many calls to check status. No clear operational visibility. So that is their sign to implement these things into their management and they can actually
Agree.
see the real changes almost immediately.
And that was so impactful, and thank you for coming.
Thank you for having me.
Yeah, sure. So today we explored something important. Zoho Creator isn't about replacing medical system, it's about strengthening operation around them. From patient intake to lab tracking to branch coordination to compliance, the possibilities are real. And the impact, less chaos, more clarity, better patient experience. And we are providing 15 days free trial of Zoho Creator right in the description. And if you need free business health checkup, link in the description.